If you are having numbness and tingling that's going from your neck down your arm and into your fingers, or if you're having neck pain with shoulder pain and maybe moving down into the arm, you're having pain throughout the arm, that your affected arm is a lot weaker. Maybe when you're at work or throughout the day, it just fatigues a lot faster than the other arm. You might even have cold fingers, cold hand. It may even be off color. These are all symptoms of thoracic outlet syndrome. But the good thing is we're gonna help you address these things today, move past it, and work on this issue to where you can get it back to 100% equal to what your other arm can do. My name is Dr. Sean Hiller. I'm a physical therapist and a certified strength and conditioning specialist. We're going to dive into this issue of thoracic outlet syndrome today. We're going to help you solve it. These are the same exercises that I would give to a client and I would give to a friend to help them get through this issue and move on and get back to doing what you love to do. Thoracic outlet syndrome is typically subdivided into 3 different categories. You have neurogenic, venous, and arterial thoracic outlet syndrome. All of them present slightly different. Some of them are gonna have more symptoms than the other, but the good thing is all of these exercises we're about to get into will address all 3 of the types of thoracic outlet syndrome, and they will help each 3 types. And also, just so you give you peace of mind, all of these exercises are very safe for whichever type of thoracic outlet syndrome you may have. The equipment that you're gonna need, we're gonna need a light to moderate weight and a light to moderate band. That's really all we're gonna need for these exercises. The first exercise that we're gonna go through for this thoracic outlet syndrome is called a doorway contraction. You may have heard the term doorway stretch or doorway opener. We call it a contraction because contractions are just better than a passive stretch. So what you're gonna do is you're gonna take your hand, you're gonna put it into a doorway, and you're also gonna rest your forearm and your elbow on the doorway as well. Now notice my position here. My elbow is in line with my chin. It's above a 90-degree angle. A lot of times we make the fault of doing it low, and that's not gonna give us what we want. We wanna be at least at 90 degrees. I like to be at chin level. So here, you're gonna go ahead and rotate your chest as far as you can. So in this position, this is a stretch. You're going to feel a stretch in the front of your shoulder, but we're not done yet. In this position, I want you to take your hand and your elbow, and you're going to push into the door. We're gonna contract the whole front shoulder girdle, and then we're gonna let off. So you're gonna go through 10 reps here with a 5-second isometric contraction or press into the door. So we're gonna rotate and contract, 2, 3, 4, 5, and then let off. You will feel this whole area contract, and you will notice when you come off the wall that you have a lot more range of motion, you have a lot more freedom. In fact, I highly advocate for you to test your range of motion before, how much do you have, and then test it after. You should have more. And a lot of folks, simply after going through this exercise, their symptoms are dramatically less after doing this one exercise. So this is a great place to start. For this exercise, we're gonna take our moderate band here. You can use a light band as well. In fact, I would probably start with a light band and move into a moderate band, because this is not easy. This is a banding throwing movement. And you'll notice some things that looks familiar. So this position is gonna look very familiar to your doorway stretch position. It's the same exact position. So we want to use that. Now we're just going to add some load to it. So I'm here, I'm going to try to throw the band forward. So the band's forward, and then I'm going to control it back. It's a banded throwing movement. So we like to put a tempo on these. I really want you to focus on the coming back part, but we're going to go forward for 1, 2, 3. We're out. 1, 2, 3, we're back. And you can see that's not easy, and this shouldn't be easy. If you had to put a number on it for a rating of perceived exertion or RPE scale, I would say you need to be at least at a 5 or a 6 for this. I would love for you to be at an 8 or a 9. But you're gonna go through your 12 reps here with that 3-second tempo. And please make sure you're in a good position to where your band does not pop off the door and smack you in the back. That would be bad. We don't want to go through this. Make sure it's a sturdy door and a sturdy band. You've got a good sturdy purchase on the door. So the next exercise we're going to go into is a chest fly isometric. So continuing along the theme of opening up the front of that shoulder and opening up really the shoulder girdle itself, we're going to start here and you're going to go into this chest fly. Now, you should have a light enough weight to where you can come back up if you need to. It should be very light. You shouldn't be struggling with this too bad. And you're gonna wanna use something that you can fulcrum your shoulder on. So on the side of the table here, I have my shoulder blade on the table, but my shoulder itself is not on the table because we want that range of motion coming out. Another thing, when you're going down, don't let the head of your weight drop below your shoulder. We want it to be above or in line with the shoulder throughout this movement, okay? So we're gonna come up, we're gonna go down. You may feel some nervous symptoms with this. If you can tolerate it, if it's just discomfort, then you're fine. Let's keep moving through it. If they're high, maybe they're high here at this end range position, I simply want you to come up until they're not so bad and you can tolerate it there. So what we're gonna do, we're coming up, we're gonna go down into that fly position as far as you're able, and then we're gonna sit here, we're gonna hold this for 5 seconds. And then you're gonna come right back up with that 5-second isometric at the bottom. Again, if you're doing this and you notice your pain levels increase with this, your discomfort, your numbness, your tingling, if it all starts to go up, then shorten that range of motion, come up a little bit higher. You're still gonna have great benefit out of it. And as you progress, you can move further and further down and you should see a difference in your symptoms. The next movement we're gonna go through is a banded horizontal row. We've still got our heavy band on the door here. You can also use a moderate band if you need to. But from this position, what you're gonna do is you're going to put your hand into the band. You can see how I have this. So with the band as it is, I'm gonna take my hand, put it inside of the band like so, and then I like to grab around. This gives you a really good purchase on the band. Of course, you can also just grab the band, that's fine too. What we're gonna do is we're gonna back up with our hand on the band like so, and then from this position, you're gonna row that band to your side. Now I'm getting as far back as I can, and this is where we're gonna do our isometric. We're gonna go through our 5-second isometric in this position. So I'm here, I'm gonna pull back as far as I can take my elbow. I'm squeezing everything I can back here, including my shoulder blade, which is really what we're gonna go after. Show with the other arm so you can see, but I'm pulling back, squeezing that shoulder blade, really trying to pinch my shoulder blades together, and then I'm gonna release. It's a 5-second isometric here as well. We're gonna go through 10 reps of this. The next exercise we're gonna go into, this is going to be a back fly isometric. So this is going to be a little different. We've done a whole lot of anterior chain work here. We're gonna do some posterior chain work. So like the chest fly, we want to take this dumbbell to its end range. So you wanna come up as far as you can. The biggest difference here though is that my arm is not gonna be straight. I want you to bend your elbow a little bit. That's gonna make the fly easier, but it's also gonna activate a little bit more of our posterior chain. So you're gonna come up, we're gonna go through our 5, 4, 3, 2, 1 isometric at the top, and then you're gonna come back down. We're gonna go through our 10 reps with a 5-second hold in this position. If you're doing these and you're noticing that you're only able to get up to like right here, because either it's so weak or your pain is too high, then let's drop the weight and let's simply just do it with your hand. Get as high up as you can with your hand, go through your 5-second isometric and come back down. That's a better place to start than with a heavy weight that won't allow you to move very well. Those are the exercises that I would do for thoracic outlet syndrome. Try them. You need to try to do these every single day. This is not something you can take a day off on. I want you to try to do them every single day. Be consistent with it. You're gonna do 3 rounds of each of these exercises we just covered. And also save this video and come back to it, do it consistently because these will help as you move on with them. If you're doing these exercises and you're thinking, what else can I do to help them? This is something else that you can try to do. Electrical stimulation is something that we love to use for issues like this because it's going to increase our blood flow. And with thoracic outlet syndrome, something is impeding some type of connectivity. So whether it be a nerve, whether it be an artery or a vein, or it could be all 3, something is impeding the flow of those signals. E-Stim is going to increase all of those signals, going to increase blood flow and muscle activation. So it's something that we love to use for thoracic outlet syndrome to get more input, to get more of an activation to the area. This is how you place the pads if you're having this thoracic outlet syndrome, maybe you're having this nervous symptoms coming down your arm. Rebecca is volunteered to allow us to apply some E-Stim pads to her so we can show you how to place these. So what you're gonna do, there's 2 different ways I like to do this. First way is we're gonna put one of the pads higher up on the neck. So if you have a thoracic outlet syndrome that seems to be more focused throughout the neck, some people it's more focused throughout the shoulder, then we're gonna start high in the neck. We're gonna place one very close to the occiput, to the base of your skull. And we're gonna put this other one right where you see the end of her trap, right through here. And that's gonna cover really a lot of the upper trap. So what we're gonna do is, we've got our pads placed. This is placement 1, and this is gonna be great for stimulating more of the neck type of issues. Now, if you have more of a shoulder focused TOS, then we're gonna move the pads and we're gonna put one pad where we just placed our second pad, and we're gonna put the other one right through here, okay? So this is a very nice spot, as far as like a very muscular spot. So we're gonna start here, and then the current's gonna pass through this area. Either one's gonna be fine, just depends on where your symptoms are. But this should be fine placement for either, should help you get better movement and really stimulate the arm to allow your nervous symptoms to start to decrease throughout the day. Guys, I hope these exercises have helped you and your TOS is feeling better after doing them. If they are, then leave us a comment. Let us know how they've helped you and what you're doing now that you couldn't do before after these exercises. If they have helped you, please like this video, subscribe to our channel, and ring that notification bell. We're posting stuff like this constantly to help people get past issues with their body and move on to the life they want to live. If you've done these exercises and you're thinking maybe your issue is more neck related, more muscular neck related, or more muscular mid-back related, we have some videos on those too. I'll leave the link in the description and you can click it to move to the next video. So hopefully this has helped you. Thanks for hanging out with us, and we'll see you on the next video.